Dr. Tom Roselle live right now. 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle, live with you in studio. Just made it back. I was at a conference in Florida, and I ran from airport to car to here, and I am waiting for your calls at 888-630-9625, 888-630-WMAL. Actually, I've been away for about 3-4 days at a conference, and I'm going to talk to you about a subject that came up there that I actually attended. I was part of a workshop as well as attending some classes, which I have to do every once in a while, and something that we treat often in our practice and something that so many of you suffer from, and that's called poor sleep. Either that you can't stay asleep, you can't get to sleep, or you just never get a restful sleep, and it's an unfortunate situation, but there's some interesting facts that most of you aren't aware of. Some of you are, but ignore them anyway, and I want to open your eyes. I want you to be aware that you can control this, you can change it. And if you've heard the program, you've listened to Dr. Tom Roselle Live, you know that we come from a platform of identifying anything that happens to you from what we call the triad of health: structural, chemical, emotional. Those are the only three things that can cause anything: either injury to the body from the structural sense, emotional stress patterns. The body doesn't know the difference between something that in fact actually happens to you and something that you emotionalize or think about, and biochemistry, all those things that go into your body, anything that's from the outside in, and how it affects multiple systems. And we're going to talk about that multiple system situation. I think you're going to be surprised. We don't get the sleep we need. We function at very, very high levels of performance, particularly here in the Washington metropolitan area, and we're out and about and going and doing, and we just stress our system out. That old friend of ours, the adrenal glands, the fight-flight system, is constantly taken in the neck, so to speak. You're being chased by the tiger and you keep running away, but poor sleep is common. And we see advertising on television to take this medication to try to get some sleep. And medications are the fail-safe for everybody, right? Well, they shouldn't be. And so we're going to talk about the medications you're taking. We're going to talk about the nutritional things that can actually do you a lot of good, but also if you're taking the wrong nutritional components, guess what? They can keep you up as well. So it's important that we identify the biochemical imbalances, the traumas, the injury, the stress patterns, and see which one fits you, because one size does not fit all. But I'm here at 888-630-9625. Love to take your questions on topic or otherwise, anything that's bugging you. You've tried, you've applied, you've come up with the same old things that really don't work. Well, let me kind of open your eyes to anything, but we're going to talk a little bit about sleep today and the fact that it's a pandemic situation. We are suffering, particularly in the Washington, D.C. area, but epidemic throughout, I would say, throughout the world. We don't get the sleep. You know that we should be getting about 7 hours of sleep a night, minimum. Some people can survive on 6. Some people need 8 or 9. But generally, 7 seems to be, for most authors, 7 hours is the optimal sleep that potentiates longevity, your ability to hang out on this planet and, function normally, be well, repair, because that's when you do repair, by the way, is when you're asleep in the middle of the night. When you're getting a good, sound sleep, your body goes into the reparative, restorative factor, and there's actually 5 or 6 different stages to sleep patterns, and in stage 3 and 4 is when your body maximizes growth hormone, which is what you need to fix things. If you don't have that, you don't fix anything. But here's the deal. Think about your life for a minute. Think about the foods that you put in your body that maybe aren't quite as supportive, all the stimulants that you're eating or drinking, the coffee, the sodas, my mantra: sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives. Anything that you're allergic to as well will jump into that category. You need to look at your environment. Are you constantly cranked? Do you wake up in the middle of the night and grab your cell phone and decide to go through and, check notes? Do you get on the computer? Do you have lights on and you're listening to the talking heads and drive yourself crazy before you go to bed at night? Have you had injury or trauma? Have you had things that have taken place that you've ignored? Well, there's an increased risk with all those things. If you have any kind of digital printout in your bedrooms while you're trying to go to sleep, it's stimulating your pineal gland, and it shouldn't be doing that. That's time when that little organ about the size of a pea is the orchestrator. Do you fall asleep just sitting in a chair? You stop moving and you're out cold. I've been known to do that occasionally, and then when that happens, it tells me I better change my mode because that's not okay. Do you eat something and you get this dumping syndrome, and within a half hour or less, it's like somebody made you go into a coma? That's an indicator that you're not getting good restorative patterns as well. Sleep disturbances, difficulty getting to sleep, symptoms that you have during sleep, by the way, like a restless leg pattern. You wake, you can't return to sleep once you wake up. Dreaming or not dreaming. Sometimes we get into a place where we're dreaming so much, we're so exhausted from going to bed that we're not resting at all. And sometimes we don't dream. And dreaming is an important part of sleep because it helps restore emotional integrity. Do you find yourself yawning all the time? Yawning is an indicator that your body's not getting enough oxygen. Kind of universally accepted. If you find that you're doing that all the time and falling asleep when you should be awake, the diagnosis can be narcolepsy. Well, there's a not really type of thing that goes along with that. The body goes into sleep cycles, and we've got to be able to maintain that. So let's talk about what happens in the different sleep situations. There's so much really to talk about sleep and what happens. I want to go through this. I want to tell you about some of the drugs you're taking and the side effects, the damage it's doing to your body. It's not okay, but we get hooked. We get into this craziness. So let's talk about those of us that, we're all cranked up and we just can't get to sleep at nighttime. We sit there, our eyes are wide open, we close the lights off, and our brain's in overdrive, and, we're constantly having conversations that are taking place in our body. It's called sympathetic overdrive, excess response. Our cortisol levels are kicking up too high, too fast, and we can't settle down. We can't get into a sleep state. And you'd be surprised what gentle supplementation sometimes can take care of that. Most of our diets are so deficient that we lack a very simple mineral called calcium. And if those of you who are doing that, sometimes just try this. I think you'd be surprised. Get some calcium lactate, but a good source, low dosage, doesn't have to be a lot. Maybe take 150 to 200 milligrams with a little magnesium before you go to bed. Or take some calcium citrate and take it about an hour and a half before you go to bed, and then make sure you turn off all the lights. You'll find that sometimes just doing that will put you into a nice, relaxed state and calm your body, will calm the muscle contractures. Magnesium is necessary to break down cortisol. If you don't have enough magnesium, and many authors will tell you that magnesium is incredibly deficient in today's society. We just don't get enough. It relaxes the tissue. It relaxes the body. It relaxes the heart muscle. It allows neurological transmission to maximize itself. And we can go through alkaline minerals, and we can talk about products that will help you sleep, like phosphatidylserine, and you take that before you go to bed. Vitamin B complex. But now here's the thing with vitamin B, and we'll get into it a little bit more, is that there is an acid and an alkaline form of vitamin D. Or vitamin B, like boy. The vitamin B can either upregulate the system, make you awake and rock and roll and ready to go, or it can calm and relax the body. And it's divided into what we call G, like girl, and B, like boy. There's an old company we've used for many years, Standard Process Laboratories, and they have worked that thing out years ago. Dr. Wally Schmidt, who is a colleague and a dear friend and been around forever, one of the smartest guys on the block that I know, has come up with how the vitamin B complex, and he wrote several papers on it, used properly can calm the nervous system dramatically and really resolve so many different problems. If we have histamine problems, many of us find, and histamine, what happens is that it's an inflammatory pathway that kicks in, particularly when you're allergic to something. So if you have an allergy pattern and the inflammation is high. Some of you are taking things like Benadryl before you go to bed at nighttime so you can sleep. It's because it serves as an antihistamine. The problem with it is that it has tremendous side effects. Vitamin B6 and P5P, or the phosphate form of the B complex, folic acid, is a vitamin that I like to use, or a nutrient that I like to use, is quercetin in conjunction with vitamin C. The production of hydrochloric acid. So many of you have no stomach acid, even though that you think your stomach is acidy. It's not really acidy. It's too alkaline. Betaine is a precursor to the formation of hydrochloric acid. And that, believe it or not, just taking that sometimes will allow your body to go to sleep. So how do you know which one of these things work for you? Well, let's talk about calcium. I'll give you a little trick. If your muscles are tight and stiff, and you're finding that you can't get to sleep at night, calcium might be your problem. Get a low dosage calcium, and I'm going to give you a ratio, about 2 parts calcium to 1 part magnesium. Calcium lactate is what I prefer. And before you take it, I want you to turn your head to the right, turn your head to the left, and see if there's any discomfort or restriction of motion, or even bending forward. Try to touch your toes. And if you can't bend fully, if you can't bend down completely, or you can't turn your head, or there's pain in bending forward or turn, then go ahead and take a very, very low dosage of the calcium lactate with the magnesium. Put it in your mouth, maybe 100 milligrams, and chew it up. Don't just swallow it, because this test won't work then. So I want you to chew it up. And then when you chew it up, as soon as you have it, and keep it in your mouth, then I want you to turn your head again from right to left, side to side, or I want you to bend forward and notice whether or not the pain is still there, the range of motion has increased or decreased. If the pain lessens and the range of motion increases, that tells you that it's the right supplement. If the range of motion decreases or the pain gets worse with that in your mouth, that tells you that it's the wrong thing that you're taking, and it shouldn't be in your body, that it's something else. And then you would go to things like antihistamines. You would go to the folic acid, and you would go to the B6, and you would go to the vitamin C, and you would do the same type of testing. It would work the same way. So you can measure these things by structural response. So here's a chemical piece that would add to a structural representation, and you can do it yourself. Now, obviously, and always, you want to use organic supplementation. You want to use organic nutrients. You don't want to put junk in your body. Don't be deceived in thinking that all nutrients are created equally, because they're not. You need to have good stuff. Let's talk about the antihistamines. Let's talk about some of the stuff that you put in your body. Now, in allergies, there are a lot of nutrients that we consider when we're dealing with a patient. Again, from folic acid and B6 and something called quercetin and betaine, and there are herbal antihistamines as well. But when you use any product whatsoever, there can be side reactions, even with good things. And the patient may show, or you may show, a positive result, but sometimes within a few days, all of a sudden it becomes worse, or there's an allergic reaction. You see digestive problems, you see skin rashing, or that kind of thing that wasn't there beforehand. So you have to be aware that there can be potential problems.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. I'm live in studio, 888-630-9625. That's 888-630-WMAL, broadcasting to you from 105.9 FM and AM 630 WMAL. Love to talk to you on any subject that you have in mind. We're talking about sleeping. You know, that thing that most of you don't get enough of, or when you do go to sleep, it's not okay. You sit and watch the tube, you get cranked up, you get angry, your head's working all the time, you have restless leg problems, anything that, you get up and go to the bathroom in the middle of the night, and it doesn't, guys, it's not always related to your prostate. There's actually a couple other reasons for that to take place. But having said that, and before we get back into the subject, I want to remind all of you of something. I need your help. I'd like you to step up, if you will. Your good old FDA has issued a guidance, quote unquote, and they're going to reinterpret a law that was passed in 1994, and they're going to reinterpret a law differently. Now, what they're going to do when it comes to your ability to have available good quality nutritional supplementation is simply this. They're saying that any substance, any nutritional product, anything that is a food that is being used as a medicinal product that came into the market after 1994 is going to have to be put through a process of screening and safety measures and going to have to be resubmitted, even though that they've already been done. Anything after that, it's going to basically effectively shut down a lot of companies that are selling good quality products. You're not going to be able to get them. You're not going to be, those of you who have gotten involved in multi-level marketing, that's a horse of a different color. We'll get my opinion on that at a different time. You're not going to be able to do that anymore. So what you need to do is you need to get on the phone and you need to call your congressmen and senators, because the comment period ends on this by December the 2nd. You got to contact them. Now, Biotics, B-I-O-T-I-C-S, Biotics Laboratories and Standard Process Laboratories are old companies. They've been around for decades. If you get a hold of them or go online, biotics.com or standardprocesslaboratory.com, or call their offices, they'll give you the exact references but you only have through December the 2nd to do this, because if this goes into effect, everybody is in really deep trouble. It's the first step in controlling your nutritional choices. So don't let them get away with this. You've got to be able to step up and handle it. And the only people that can handle it are you. Let's go to the phones. Patricia, how can I help you? Thank you for calling.
Hi. I wanted to know what we could do about hyperthyroidism. My husband has been diagnosed with that, his overactive thyroid, and I wanted to know, is there something that we can do, like exercise or foods we can eat, or something to get rid of that other than medication?
Well, you missed a really great program a few weeks ago, because Dr. Poe was on as my guest, one of my colleagues in the office, and we talked about all kinds of thyroid problems. Mm-hmm. So I'll give you a short answer, but then I'm going to refer you. Go to RoselleRadio.com.
How do you spell Roselle?
Roselle, R-O-S-E-L-L-E.
Okay.
RoselleRadio.com, and you're going to find all my past programs there. And go back and you'll find the one with Dr. Poe on thyroid problems. It should be linked online. You can download it, you can listen to it, and you'll have a lot of data there. But nevertheless, thyroid problems, regardless of what they are, whether they're hypo, whether it's a Hashimoto's thyroiditis, which is an autoimmune problem, all have a reason why they come about. Generally, with a hyperthyroid pattern, you're getting a situation where the thyroid is in overdrive, and it can be as a result of an inflammatory response. It can be a hyperadrenal state where your fight-flight system, your sympathetic response, is just pushing way too hard, so you're getting what we call adrenal hypothalamus pituitary axis overload, and the adrenal glands are kicking in and they're causing the pituitary to push out more thyroid stimulating hormone, and is causing the thyroid to put out more T4 and so forth. Now, I'm being very basic, but here's the deal, is that you have to get the system to calm down. You have to look for allergy reactions. You have to find out if there's any neurological pathway problems that are associated with this, meaning nerves that are irritated and so forth. So it's not a simple thing of saying, do this. What I would advise your husband to do to begin with is dietary patterns that are very organic, very alkaline, and I would do exercises that calm the system, like yoga, Tai Chi, and so forth. Pat, I'm sorry, I wish I had more time. We're coming up against the news. You can give us a call at our office. I'll be more than happy to go back and forth, but go on to RoselleRadio.com and you'll be able to get that program.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I am in studio. 888-630-9625. That's 888-630-WMAL. That's how you find me. If you'd like to visit us online, go to RoselleCare.com. That's RoselleCare.com. If you'd like to check out the past radio programs, go to RoselleRadio.com and download the ones that you want. The last caller calling in about a thyroid problem, I would have loved to spend the entirety, but then we couldn't talk to you about sleep disorders. But anything that is hyper, you've got to calm the body down. You've got to find out what things that are jacking it up. And so many times it's allergy reactions, particularly in thyroid conditions. You've got something that the body is overreacting to, and that can be fixed. You don't do the traditional stuff with the drugs. That's only suppression. You can fix the body's response neurologically, and once you fix that, the body gets to where it needs to go. And also nutritionally, deficiencies have to be put back into a normal pathway. Now listen, we're talking about sleep problems, and all of you at one time or the other are dealing with the inability to get the proper amount of sleep. And we said that whether it's can't get to sleep, or wake up after you go into sleep, or you can't dream, or you dream too much, or you have to get up and go, there's a lot of different reasons. But let's talk about some of the meds that you're taking and why there's a problem. So sleep medications have different side effects, and you need to have alternatives, but you also need to know what you're doing. Let's talk about a very common drug called diphenhydramine, which is affectionately known as Benadryl, and it's an antihistamine. And there's things like Nitol and Unisom and Tylenol PM and Midol PM and Advil PM, and they just put the PM on there so you can take it at nighttime and kind of knock yourself out and go into coma. Well, when you're dealing with Benadryl particularly, let's take that one. It's an antihistamine and it has side effects. It's a very potent drug. It's known as an anticholinergic agent, and it dampens the inflammatory response. But here you got minor things like dry mouth and throat, and then you get increased heart rate, and then your pupils, those little black things in the middle of your eyes, well, they open up really big, they dilate. You start holding urine, urinary retention. You can't get rid of the urine. And constipation. And by the way, you're going to end up with hallucinations, and you can end up with delirium. So it's not minor, but there's more to it. If you take Benadryl, you can also end up with very significant motor function problems, such as ataxia, such as burning and flushed skin, plus a blurred vision. And the list goes on, and we can talk about memory loss, difficulty concentrating, your eyes will go bad, visual disturbances in both near farsightedness, but also in blurring. There's some reports out there that say that it will also affect the lens, dizziness, irritability. I mean, some of you don't need to be any more irritable than, things that you have. But then you can go on and you talk about itchy skin and confusion and excitability. And guys, if you're taking Benadryl, unfortunately, one of the side effects is erectile dysfunction. Ain't going to work, and you wonder why. The drugs out there are not good. So you say, so what do I do? Well, first you got to find out always what the problem is, and whether there's an injury that was involved, whether your diet is, stinks, or, what really happens. But let me tell you, if it's a histamine problem and Benadryl seems to put you to sleep, again, you got to go look at things like folic acid, B6, quercetin, vitamin C, betaine hydrochloride. You got to look at the antihistamines that are herbal. They work very, very, very nicely. Turmeric in boswellia and so forth in combination can work beautifully. Natural antihistamine products are very useful, particularly when you have reactive patterns to some allergies of foods and airborne things and things that you contact in your skin. People don't think about what they're exposed to and what they absorb through the skin and the products that they put on their skin. Those can keep you awake. Ladies, you with your hair dyes. I'm a son of a hairdresser. Both of my parents were hairdressers. So I saw these reactions. And thinking back over the years, I remember a lot of my parents' clients, patrons, come into the salon and they would talk about different types of things. And now with, so many years of practice and the knowledge that I have, I said, that could have been part of all that. You have to make sure that you identify the exact situation. If you have difficulty getting to sleep, try, for example, just take calcium and magnesium together and change your diet for a while. Get rid of the garbage. Phosphatidylserine often will calm the body down, but you need to take it generally about an hour and a half so it can get into your system before you go to bed. Now, initially in the beginning of the program, I talked to you about B vitamins and B versus G, and there's a lot of distinguishing features about them, but what I really want you to know is the G portion of the entire B complex relaxes the nerves. It opens up vasodilation, increases circulation to the body. If you have bad menstrual pains, as a side, ladies, the G portion of the B complex will act as a general relaxer. As a general tonifier, to, kind of upregulate the system, the other portion of the B complex is what's necessary. So you use them accordingly and based on what the symptomology is. You can't really get in trouble, but you're going to know right away. Remember, measure something. If you take something and it's going to be beneficial to you, you can do the same test that I told you before. Look at a stretch reaction, bend over, turn your head, see if there's a decrease in pain pattern. If there is, you know that you probably have the right product. If it's making things worse, not so much. I learned years ago from a very, very dear man, no longer with us, the father of applied kinesiology, Dr. George Goodhart, who, by the way, was the first chiropractor that was appointed and anointed to the U.S. Olympic medical team, and that was in 1980 at Lake Placid. Dr. Goodhart always said, measure everything that you do. Measure, measure, measure. Measure range of motion, measure pain, and you can do these things yourself, because if you eat something, if you put something in your body, if you get exposed to something, and you become an observer of your own system, you will notice changes, and those changes can be documented. You can say, well, when I did this, I felt better. When I did this, I didn't feel so good. So a judicious man would say, well, if I'm doing that, it's not feeling so good, or I can't sleep anymore. Guess what? Maybe I shouldn't do it. 888-630-9625. If you have a question on anything we're talking about, or anything that you have in mind that we're not talking about. So find the problem, take a nutrient, see if it makes a difference, and apply it accordingly, and see if it changes your state. If you have difficulty staying awake, so you're in class, or you sit down, or you go to sleep immediately, one of the things that I think about immediately is allergies. And you walked into a room and you can be allergic to the environment. You put something on, a perfume or deodorant or whatever, and you're not good the rest of the day. Or you have something to eat, more importantly, and within minutes your body just goes out. Well, you need to understand that there are things that are responsible for those allergy reactions. Also, we have something called a small intestine dumping syndrome, and some of you go way too long without eating, and that can be part of it. You're not getting enough protein. That can be part of it. Or simply there's a change in the osmotic balance due to fluid in the intestinal tract, and that can be a problem. Now, when you have difficulty staying awake, we go into the place of a non-neurological narcolepsy, and there's two parts. There's a neurological-based, a brain function problem, and then there's a non-neurological, and that's usually allergy reaction. And you have to make sure that everything else is working, that the patient gets enough sleep, they go into a normal sleep pattern, everything is doing well, then it goes to neurological basis. But if it's not that, then it's something else. How about somebody who's yawning? Well, if they're yawning all the time, as I said earlier, they need oxygen. Yawning is an oxygen deficit. And again, we're going to look at allergy reactions. We need to acidify the body because the gut is non-acidic at that point, so we have to add hydrochloric acid precursors. One of the things that also make you yawn is somebody who is a borderline diabetic. So we have to check out blood sugar problems. Let's go to the phones. Diana, how can I help you?
Yes. I have two questions for you. All right. I've had AF and had the ablation done and been on Toprol for a few years. Now, since I haven't had any type of dizziness or any, heart problems that I know of, he wants to cut my 50 milligram Toprol pill into 1/4 daily.
Okay.
I just wondered if that's safe to do, be off any, heart medication.
Well, if your doctor's giving you the medication and he's a cardiologist, God bless him for taking you off of it. But the thing that you want to make sure is that your mineralization balances are normal. The heart needs lots of magnesium. It needs calcium. It needs balance of potassium.
Yes.
Particularly calcium and potassium are the two most important things that keep the regulation of a heartbeat.
What you have just mentioned, I take it all.
Okay, so then let your doctor, he's going to monitor you, let him take you down with the idea, God willing, that you can get off of them.
Oh, that's wonderful.
Okay, but I mean, he's your primary. So,
yeah.
Anytime I see a medical physician that wants to take a patient off medications, I applaud them. I stand up and salute them. That's a great thing. He's somebody that wants your body to work the way it's supposed to.
Yes.
So, hopefully that helps you.
All right. Now, my other question is this. All right. I've been taking a lot of supplements, including every one that you have mentioned. All right. Then one week I decided I'm taking too many of them.
Okay.
And I didn't take any except for the ones you mentioned. Those are the only ones I took. I noticed that week, and there may not be any correlation, that I didn't have edema in my legs all that week.
Okay, so that's what I was just telling you earlier. You can be allergic to supplements as well as allergic to foods and environment and so forth. And also, if your supplementation is not natural, if they're not organic, generally less is better when it comes to nutritional supplementation. So that tells you something. Those would have to be tested. Remember, I just said when we're dealing with anything, you want to measure. That's a measurement. You went off of them. You felt better. Stay off of them until you find somebody who can work with you that can put you on the right supplementation. Obviously, we'd love to do it, Diana. If there's anything I can do, let us know, and I'll be more than happy to work with you. Bill, how can we help you? Bill? Hello?
Yes, hello, I'm here.
Hi, Bill. How can I help you? Dr. Roselle.
Yeah, good afternoon, sir.
Good afternoon.
I wake up with a stuffy nose and dry throat. That's been going on for like a few weeks.
Okay.
And I don't know what to do. I don't know what's causing it.
All right. Well, you're in a lousy time of the year right now. You've got a lot of the leaves coming off the trees, and they're rotting. They're falling on the ground. They're wet. High mold levels are all about. And in addition to that, unfortunately, we're going into an early viral pattern this year. I've seen a lot of it in the office. People are coming in with upper respiratory problems. And if you're not careful, it goes quickly to bacteria. So what I would say to you is, are you getting anything that's green or yellow discharge?
Yeah, yellow or green, yes, sometimes, yes.
Okay, so that tells you that may be bacterial. First thing I would do, get rid of anything that is sugar, anything that is dairy, anything that is wheat in your diet, so you can take the stress off the body for a short period of time. Increase the amount of water in your system, but then go to the store and get yourself something called Inula berberis. And take it directed as it says on the bottle 3 times a day. And
it's a liquid?
Yes, it's a liquid.
Okay.
And take it directly as it's indicated on the bottle. And you'll know within 24 hours if it hurts you, meaning it's going to increase your symptoms. Anything that increases your symptoms, you want to stop. Anything that makes you tight or stiff, you want to stop. But give that a try, and let me know the response. But you can get a hold of me on our website at rosellecare.com, or give one of my doctors a call at 703-698-7117. Or if need be, come on in the office, and we'll be more than happy to see you.
What's the name of the thing?
It's Inula berberis.
Inula, I-N-G-U?
I-N-U-L-A. Inula berberis.
Dr. Tom Roselle Live continues now. 105.9 FM and AM 630 WMAL.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle Live, broadcasting to you from 105.9 FM and AM 630 WMAL. You can always reach us here at 888-630 WMAL. We're here every Sunday at 12 noon, bringing you the most up-to-date information on integrative care from a chiropractic, acupuncture, nutritional standpoint of view, putting all the systems together and telling you what really works and how to solve the problem. It's got a couple things. The problem with this program, it's way too short, and I've got much more to tell you. Now, we're talking about sleep disorders, and I'm not going to be able to get into all of it before we're done for the day, so I want you to go to rosellecare.com, which is our website, and go to our Facebook link. Our Facebook link has a blog that I'm always writing on. I'm going to write all of the stuff about sleep disorders so you can go there. And I want you to take advantage of it. Use the information. Let us know if we can help you. You can always write us at rosellecare.com or call us at 703-698-7117. But for right now, we have a couple more callers. I'm going to try to at least to get to one more. Pete, how can I help you?
Yeah, hi, Doc. Question. You mentioned in passing briefly last week that you advised against drinking bottled water, I guess because of the bisphenol A.
Yeah, go ahead. The bisphenol, the BPAs are carcinogenic.
The problem is I drink bottled water almost exclusively because of the tap water's got, chlorine and fluoride and
I agree.
all pharmaceuticals. So what's the alternative? I mean,
there's lots of things. And so you can do the same thing that I do. I filter all my water, and I either put it in a glass container, or there are many BPA-safe, plastic water bottle-safe sources. And I'm going to give you a website to go to. It's simply called A Journal of Sorts, S-O-R-T-S. And it's the title's This Green Life, and you're going to find a listing of all kinds of things. Now, REI is a company that makes for hiking and camping and so forth water containers that you can take that are BPA free. And there's a list. They put them in order of different types of chemicals. So you need to go in there. We could spend the entire program on that, but that at least gives you a beginning. I'll also blog on that, and I'll try to give you some very specific information on that. But start with that. Realize that you have to filter your own water. Glass first. There are hard plastics that are more safe than others, and they don't leach out the BPA the way some of the other ones do. But also remember that anytime you use plastic on anything, whether you heat it or get it cold, it's going to leach the xenoestrogens, the BPAs, and you got a problem. Anyway, I'm sorry, Pete. I wish I could be more helpful, but thank you for your call, and I appreciate it. I wish we were here longer, and unfortunately we're not. But nevertheless, go to RoselleCare.com, go to our Facebook blog, and I will put the rest of the information about sleep disorders, and I will be here next week, Sunday at 12 noon, bringing you more information, things that you can apply, things that you can use. You can always get a hold of us at RoselleCare.com. See you next week. Bye.